Hi, my name is Lauren Schuster. I'm a personal trainer and fitness instructor, and today I'm going to show you a great postnatal workout. So we'll get started with proper breathing technique to activate your core and pelvic floor muscles. So I'm going to get you to lie down on your back. If you're relatively new postnatal, you always want to come down side first. In case you have any separation, it's a safer way to get down to the floor. And then roll onto your back. So we're going to take heels as close to the behind as you can take them, about hip width apart, knees, same thing, hip width, all in a line. And then just settle in to the floor. So the first part of the breathing we're going to start with is you're going to take your hands onto your lower ribs. That's just where your waist cinches in. We're going to take an inhale. As you inhale, you focus on the ribs going wide laterally, so out to the side. So inhale and exhale just how you would regularly. So focusing on the expansion with the inhale. And the exhale, just letting the ribs release. We'll do that a couple more times. Inhale. Ribs go wide, let the back of the ribs settle to the floor. Exhale, release. One more time. Inhale, ribs wide, and exhale to release it. So now we're going to add the pelvic floor and core activation during the exhale. So you start with your inhale, take the ribs wide. As you exhale, you're going to draw up from deep in the pelvic floor, almost like you're zipping up a pair of tight jeans. So first drawing up through your pelvic floor, and then towards the belly, drawing in and up on the exhale. So let's try that. Inhale, let everything go, wide through the ribs. As you exhale, initiate with pelvic floor drawing up and in, then draw the belly in slightly. Inhale, let everything go, ribs go wide. Exhale, drawing up and in, belly to back, zipping up, ribs release. Let's do that 2 more times. Inhale, let it go, ribs go wide. Exhale, focus on that pelvic floor, drawing up and in. That same motion as when you're trying to stop yourself from peeing. That's that pelvic floor activation that we're getting. And then release. Last time. Inhale, wide through the ribs. Exhale, draw up and in, activating the core. So we're going to take this breath and we're now going to use it with every exercise we do next. So the first one we're going to do is great for pelvic stability. So we're going to create mobility through the hips, but stability through the belly and the back. So just getting in a proper pelvic position, you want your hip bones in line with the pubic bone. So if you think that you're balancing a bowl of soup right on the pelvis, it creates a triangle, and if your back's too flat, the soup's going to spill. If it's too arched, it's going to spill through your legs. So we find that midpoint, and that's your neutral spine. So you're going to inhale, and then as you exhale, we'll start the breath, draw up and in through the pelvic floor. You're going to let your leg drop out to the side, only as far as you can without that pelvis tilting. Stability through the pelvis, movement through the hips. And then on the inhale, you can take it back. And we'll do 8 on this side. So inhale, ribs wide. Exhale, initiate first, pelvic floor. Draw up and in, contract, drop it out. Hips stay level, inhale back. 6 more here. Exhale, drop it out. Inhale to return. Exhale, up and in through the pelvic floor. Inhale, back center. Few more times. Exhale, initiate pelvic floor lift. Take the knee out. Inhale back. Exhale, drop it out. Inhale back. We'll do 1 more time. Exhale, drop and in. Inhale, return. And now we'll try the other side. You may find you have more stability on one side than the other. So if you do one side and you find it's hard to keep the hips stable, only do that side and practice creating stability. So inhale just to prepare, exhale, drop it out. Inhale, come back center. Once you feel you can keep your hips stable, you can take the hands down to the floor, palms up, and work on opening your shoulder as we do this exercise. Take it back in. We'll do 6 more here. Exhale, take it out. Inhale in. All the time, really keeping your ribs released down to the floor. Inhale back. A few more times here. Exhale, initiate the core. Drop it out. Take it back. Also, focus on your neck alignment too. As you're taking it out, chin slightly tucked, lengthening the back of your neck. And we'll do 2 more here. And then coming back and taking it out 1 more time. So for me, this is my weaker side, so I can feel I'm shakier on this side. I probably need to practice this side. Okay, perfect. So you can release that. You can give the pelvis a little bit of a tilt forward and back. And we'll find our neutral spine again. And then from this position, now that we've created some stability through the pelvis, we're going to start to work a bit deeper into the core with a heel slide. So this is a great first step to activating the core post-baby. So let's take the hands, palms up, activate the upper body by drawing the shoulders back, opening up the chest. We're going to take an inhale, and then as you exhale, draw up and in. We're going to slide that leg out only as far as you can without the hips tilting. So keep that stability. Inhale, you're going to take it back, and we're going to switch. Exhale it out here. Inhale back. Exhale it out. So you want to feel most of the action coming through pelvic floor, abdominals. If you're feeling a lot through your hip flexors, you're going to want to focus on trying to release them. So they're right in here. You may want to try to draw up and in a little more through the belly and back. You may want to try squeezing your behind, squeeze through the glutes to take work out of the hip flexors. And then coming back. They're one of those muscles that are overworked, and they often take over for the lower ab and pelvic floor muscles, which we want to strengthen. So take it back. Exhaling out. You don't have to straighten the leg completely. Most important is stability. So let's do 2 more each side. Take it out. Inhale back. Out. Last ones each side. Great. So we're going to come onto our side, work a little bit more through our hips and through our glutes. So the glutes are important because they help to take work out of the lower back, which is often tight and overworked. So this one's called a clamshell. It's a classic physio exercise which targets glute med, and then you're trying to open up through your hip flexors with this and get more core activation. So you want your heels in line with your hips. The starting position is that if you had a light shining from your belly button, that you want it to kind of angle down to the floor. So you take top hip forward a little bit. You keep your neutral curve, so that's if you're on your back, that the soup's balanced properly on your belly. Heels are together. We're going to inhale. You can feel the rib press into the floor. And then as you exhale, draw up and in. Initiate always here and open up the leg. You can take your hand to your glute because that's where you want to feel the work, not here. Take it back down. So initiate core activation, squeeze, and then take it back down. What you can also practice once you have this lower body working properly is to create a little space between the floor and the ribs. So that'll activate through the abdominals a bit more. And back. Taking it up and in. Feeling at that end point, you're really getting the glute, the behind activating. 4 more here. You can also take your hand just inside the bony part of the hip bone. If you press in here, before you move the leg, you should feel a tightening. That means you're activating deep abdominals and pelvic floor. And we'll do just one more and then we'll switch sides. So yeah, you can feel a little shake maybe at the top. So that's where you may have some weakness through the hips. So let's come on up. Pressing up, we're going to come back down onto the other side. So lowering yourself sideways is always best than just coming from your back and down. And just resting wherever is comfortable. So the heel's in line with the hip in line with the shoulder, neutral curve through the spine. Create a bit of length between the rib and the hip and lift up slightly. So we're going to inhale. As you exhale, open it up, squeeze, try to get the work into that hip. And then inhale back down. Exhale, squeeze up and in, open up, and down. So why do we want to activate the pelvic floor? We often want to activate that because post-pregnancy, women deal with a lot of issues, urinary incontinence and often, or prolapse, and often that's a result of weak pelvic floor muscles. So any of these exercises that cause us to lift and work the pelvic floor are going to help you with those issues. So we'll do about 4 more, drawing up and in. So this is slow work and it can be boring work, but it is absolutely essential post-baby if you have any dysfunction in your core. Often lower back pain can be indicative of some type of dysfunction post-pregnancy. So these exercises are great. It's all about stability and mobility in the hips. Almost there, a couple more. And then you can release that. So we're going to come into some quadruped position. So that's on all fours. What you just have to be aware of, if you are coming into all fours and if you have been diagnosed with diastasis, which is in a separation of the abdominal, the rectus, the main muscle of the abdominals, you have to watch out if you're forward and you're not really able to keep drawing up and in through the belly. You may not want to do these exercises. For the rest of you that are feeling that your strength is starting to come back, you can come into this position because it's amazing for shoulder and hip stability. It also frees up your pelvis, so you're able to activate more core muscles than you would in a regular crunch position, which for postnatal women, newly postnatal, is not ideal. So we're going to come on to all fours. To get into the position, proper position, draw the elbows wide, then you're going to scoop them up and in so that the elbow pits forward. This creates stability through the elbow joint. Press a little more into your thumb and index finger. Knees are right under the hips. And the first one we're going to do, even doing this is sometimes enough, is tuck the toes under. You're going to take an inhale. Inhale, you're letting your pelvic floor release. On the exhale, you're drawing up and in, and we're going to just hover our knees up. So we're just holding here. We'll try for about 20 seconds. So you may feel you want to come onto the pinky fingers, take that pressure into the thumb and index finger pad to stabilize your wrists. Draw your shoulders back, keep scooping the belly up and in. A few more seconds here. And then you can release that. So if you didn't find that challenging enough, we're going to do another set. And this time we're going to flatten out the feet. So this gets a bit more flexibility through the ankles. But if that doesn't work for you, just keep toes tucked under. So flat the feet. Inhale. Chest comes through. And then as you exhale, drop through the pelvic floor. Take it up. Hover the knees. So when you're here, you don't want to flatten out. You don't want to overarch. You're keeping your neutral spine. Holding here, this is great for core stability. 10 more seconds. Okay, perfect. So we're going to do one more variation of this, which is more advanced. So just make sure that it does feel good for you. What we're now going to do is a weight transfer. So we'll come back into that quadruped position. Tuck the toes under. Lift the knees. So now, inhale. As you exhale, you're going to maybe take the hand up. Inhale, back down. Exhale, maybe the other one. Inhale, back down. Exhale, maybe the right toes lift. Inhale, back down. Exhale, left toes. And we'll keep going through that, shifting a bit. So keep those elbows hugging in. Lift up. Exhale, tighten. Inhale, center. Lift up. Release. Let's try that again. Lift up. Feet. Release. Lift up. Release. We'll try it one more time. It's quite challenging. It doesn't look like much. Lift it up. Release. Keep the core activated. Up. Release. Couple more. Up. Release. And then last one. And release. Okay, perfect. Let's just come into one stretch to finish. So downward puppy, you're going to walk the hands out. You're going to keep the hips up. We want to get more shoulder and upper back flexibility. And then lower yourself down. If it's comfortable, let the forehead come all the way down. We're going to hold here. And just let everything go. And then to come back up, just slowly walk the hands in a bit. And that's the workout. So before you start the workout, you want to do about 5 to 10 minutes of just light warm up, arm circles, some light steps side to side, just warming up your joints so that then you can go into the workout. And feel free, you can run it through once or twice, see how you do. And thank you for joining me.